finding. And here we see a child with more diffuse freckling. We certainly see it in the groin and the axilla, but it can be more diffuse. But I have a couple pictures of what it looks like in the axilla there, and here's sort of a close-up. And they really just look like the typical freckles you'd see anywhere else on the body. But it's that particular location that helps us confirm the diagnosis. So looking at the peripheral nerves, neurofibromas are basically benign tumors that occur on the nerves. They can occur on nerves throughout the body. There's no real standard classification for neurofibromas, but one easy way to sort of distinguish them is to call them either discrete, so ones that are just very isolated in one spot, or certainly the plexiform neurofibromas. The discrete neurofibromas are not cancerous in any way. Again, they can be a cosmetic problem, but in general they are not really a health problem. The plexiform neurofibromas, however, are very difficult and can be quite devastating. They occur in about 30% of individuals with NF1. They can be internal or external, and they can cause significant medical problems. And I have a few of pictures of my patients with plexiforms. I need to add too that it's important to realize that plexiform neurofibromas do have malignant potential. This occurs in about 10% of patients. And signs that there may be a malignancy are rapid growth, severe pain, and then new neurologic problems such as weakness or tingling, numbness, bowel or bladder problems. And this is basically a medical emergency if this happens, because these tumors are very difficult to treat and resistant to many of our therapies, and also difficult to take out. So patients with plexiforms, we try to counsel that you need to let your doctor know immediately if you're having warning signs. So here are a few of my patients. This is a nice young lady from one of our NF camps who had a plexiform involving her neck. Jennifer will recognize her from our camp many years ago. This is another one of my patients. This is an MRI scan, and we can see these tumors very easily on the MRI scan. It's all this bright area here, but I think you can appreciate by how diffuse it is. It's involving the neck, the arm, and it also, I think, shows that you can see how this might cause pain, weakness in the arm, tingling, numbness. It's also in the chest, so it can affect the breathing or the ability to swallow as this lesion grows. And that's why there's sort of an urgent need to develop treatment for these kind of tumors. Here's another patient of mine who has a plexiform along her spine. So when it's all this bright area here along the spine, so when this lesion grows, it causes a curving of the spine. And obviously, this is very problematic, and having scoliosis that severe definitely needs some attention. And this is a patient who had a malignant peripheral nerve sheath tumor. So we can also see that on the MRI. Unfortunately, the growth of this tumor is just sort of taken off, and we've kind of lost the organization of the anatomy here. And again, this is a very serious tumor, but you can also appreciate it's kind of difficult to do surgery on this because you can't take all of this out. So while some of it can be removed, patients also need chemotherapy and other treatments for these kind of tumors. Moving on to the brain manifestations of NF1, many of you probably heard about UBOs, or T2 hyperintensities. These are bright spots that we see on the MRI scan. They occur in very common locations, so when we see them, we don't get alarmed because they usually have a very typical appearance. They happen in the same location. We see them in almost everybody with NF1, particularly during childhood. There has been a lot of research done into their relationship with the cognitive disabilities in NF1. But by the time early adulthood happens, they're actually sort of resolving. And Jennifer may cover some of that in her talk today, too. But here's what they look like. So this is a slice of the brain, and these little bright spots right here are in the basal ganglia. And those are just kind of the little UBOs. And this is another slice of the brain. This is the cerebellum and the brainstem, and these are all the typical locations of them. We do sort of monitor them sometimes to make sure that they're not tumors, because they can be occasionally a little difficult to differentiate from tumors, but basically they're just benign lesions and very common. The cognitive dysfunction you're going to hear a lot more about today, but it's also very common. It can happen in about 30 to 65 or 70% of children. There's a wide variety of learning disabilities, and recent research has shown that probably about 30 to 50% of individuals with NF1 are going to have ADHD or symptoms of ADHD, and again, Jennifer will talk to you a little bit more about that. It's been studied a little bit in children and not so much in adults, so if there are questions about that, we really don't have any literature on how this affects adults yet, but we're going to be getting there soon. Patients with NF1 are also at risk for brain tumors. Optic gliomas are the most common type, but we also see other lesions such as the brainstem gliomas, astrocytomas, ependymomas, meningiomas. The optic pathway gliomas are the most common.